Thanks for joining us for Orr Group's Partner Perspectives. One of the best parts of our roles and jobs here at Orr Group is the opportunity to meet, work with, and learn from many dynamic leaders across the sector. This series is designed to help us share some of them with you. Today, I'm joined by one such leader, a friend and the CEO of Planned Parenthood Mar Monte, Planned Parenthood's largest affiliate, serving communities throughout mid-California and northern Nevada. I've had the privilege of working with Stacy over the past year plus. We've helped design and implement the beginning implementation of a transformative fundraising effort. Also was able to serve an interim leadership role and work with Stacy leading their development staff through a time of transition. Stacy Cross, thanks so much for being here, and more importantly, for allowing us to be part of your work. Welcome.
Well, thank you. Thank you, Craig, for allowing me to do this. And it's been just an absolute pleasure working with you.
Thank you. So we'll jump right into it. You've had a great career, and I think we can learn a lot from it. But over the course of this career, you've led Planned Parenthood organizations really across the country in some pretty diverse communities. You've witnessed some real significant changes across the sector. Could you share some sort of key trends and opportunities that you've seen, and maybe let us know how those insights and experiences have shaped your work?
Thank you. I think when I think about when I started 23 years ago as a Planned Parenthood CEO, one of the really major transitions that has occurred is that Planned Parenthoods and other nonprofits are really thinking as a business and acting as a business. You realize that you can't going back to the old saying of no margin, no mission, it's important to be thinking and acting as a business, not only for the healthcare that we provide, but also in order to have nice health centers, to have staff that is paid adequately. And that's really important, to really focus on your staff as your most important asset, because they are everything. And so making sure that you have health centers that have good technology, that are clean and organized, and that you are treating both patients and staff with a lot of respect is really important. But I think the biggest change is that we have gone from having volunteer-run organizations to being professionally run, and that makes a difference in the quality of healthcare that we provide across the organization. As you said, I've been a CEO at 3 separate affiliates, from small, medium to large, and it's all basically the same thing, but making sure that you're treating your staff with respect, and then also organizing yourself as a business. And things have gotten harder. Healthcare is much more complex, with a variety of things that have happened over the last several years with the Affordable Care Act. That made some changes because none of us were like billing insurance, and now we're doing that in various places. So the level of complexity requires more professional staff. And so it's been a really interesting to watch everybody move through this process.
Absolutely. And I would definitely commend you, on all of those things. I've been able to watch you do that up close, but particularly the health centers. I mean, I got to be with you all when you opened the new center just outside Reno. And I've seen the progress on the fantastic new center in Oakland, and just it's exciting, the level of care and the level of professionalism that you all can deliver to your community. So, leading Planned Parenthood Mar Monte, right now is a critical period for that organization, I'd say for the country. Yes. What specific challenges and opportunities has this kind of moment in healthcare and moment in reproductive health in particular created for your team? And what are you most proud of that you've been able to accomplish recently?
When I got here 7 years ago, we were the largest, but we needed a lot of love and care. So the first thing that we did was we started with what I call a refresh and renew strategic plan. So we really looked at every aspect of our affiliate, from billing to our health centers to our technology, really working through every department to make sure that everybody everybody had enough resources and they were doing the things that they needed to do, that they had the right training and the right skill set. So that was one. The other is that really in having staff walk into like the center that you were talking about, the new center in Reno. We went from a very small center that was 2 exam rooms to now tripling our capacity. Not only do patients walk in there and are in awe of the fact that they may slide to 0, but they are getting the same quality healthcare in this beautiful new facility as anyone else, because that's important. But the staff are also feel more respected, and they know that they're providing care in a facility that is beautiful and has the right technology for all of our patients. But if I could pick out a couple of things over just some things that have happened, I would pick out, for example, COVID. We really did a fantastic job transitioning, and it really had to do with the fact that we were also the largest Planned Parenthood. We are the largest Planned Parenthood in the country. So we quickly, because it kind of hit out west very soon, we developed materials, we developed process and procedures in multiple languages, because that is the population that we serve. And then we shared all of that with every affiliate in the country, so they didn't have to start from 0, from signage to doing curbside delivery to also offering, we did testing for first responders through across our service area, because we had health centers and places where they didn't have access to that. So we did a lot of things. We also transitioned our team to a hybrid model, and we've continued with that. So we were able to share all of those materials in multiple languages with several affiliates. And I also wanted to think of one other project, because it's been in the news lately, and with the change when Dobbs happened in June of 2022, we quickly transitioned because we were prepared for that. You know me, because we've worked together. I like to be prepared for every possible scenario. So we knew because of the election in 2016, this was the greatest likely time for Roe to get overturned. So we were very prepared for that. But we also listened to what they said with the leak of that. And so we knew there were other things that were at risk. Birth control was at risk, for one. Things like marriage equality was at risk, but also different methods. And one of the things that we have done is we think it's important that anybody that wants to be a parent can be a parent. And IVF, for example, is extremely expensive. So we decided that we would expand our services to provide as much as possible that we could provide at a Planned Parenthood before they had to go to the more expensive treatment in another facility. And I kind of think of it as we've provided low-income resources and opportunities for our patients that want to be parents, that are non-traditional parents, and especially with the attack right now on IVF. So it's kind of like you've gone through 2 years of junior college at an affordable place before you go, and you've saved your resources for this other university. It's the exact same concept, that we have all the resources available for patients that want to be parents, so that when they have to go, they've had everything done and are as prepared as possible for this really expensive procedure. And then the other thing that we did during COVID is we made a really strong commitment to offer gender affirming care at every one of our health centers. We were just in the process in June of 2020 or July 1st of 2020 to kick off a brand new strategic plan. And we made it through that without having to have any substantial layoffs or cuts. And our board, who I'm extremely proud of, also made a commitment to continue with some of the things that we were growing and expanding. And one of them was gender affirming care. And so we now offer it to every one of our health centers. And it's even more important right now that we did that, than before because some of the attacks on gender affirming care across the country. We are here and available not only for patients coming in. Last year, we served patients from 41 states for abortion care, but we're also helping patients for gender affirming care that can fly here and get that care in states that are really more challenging.
Yeah, I mean, it's just really amazing outcomes. And I think all rooted in this idea that you talked about around like really kind of transforming and professionalizing the organization bit by bit has allowed you to do that. And like I said, it's been a real privilege to have the opportunity to work with you as we've done the same thing through the fundraising apparatus at Planned Parenthood Mar Monte. But, you've gotten to know our team, you've worked with us a lot. In what ways has that partnership with Orr Group really impacted your work?
Well, the love and respect is mutual. When we hired you, it was really important. We needed a transition in our development team, and it was really important. And you also were our interim chief development officer. We not only needed our teams to be uplifted and for them to feel like, yes, I can do this, and you push them and encourage them to do this, but you also really helped with the culture change of setting goals, expanding, and getting this comprehensive campaign that we're ready to kick off, which we're really excited about because you're going to help us. And I feel like Orr has been our partner and you've been our partner to help us kick off for the future, to be able to grow our annual fund because of you. You really helped build confidence in our team and know that they can do this and know that they can make bigger asks and know that yes, it's okay to ask for money every time and even ask bigger, which is important. But also you're going to help us on a path towards a future, which is building our annual fund, building and growing and completing a comprehensive campaign so that we are prepared for now, but we're prepared for the future. And our partnership with Orr has really been vital, also helping me hire our new chief development officer, Rebecca, which has been just an incredible gift to our affiliate. She really is helping us a lot. But we continue this partnership with Orr because we know that we need the help and support to continue to complete this campaign. And really, I think without Orr, we would not be where we are today. With our new annual campaign, I love that it's a marathon campaign. As a runner, our goal is a marathon number, and then we're going to keep growing that every year. And our team is now really prepared for that. They know that's a possibility. They know they can do it, and they know that every year we need to grow. And it's really because of you, Craig, and also Orr. So thank you.
Well, thank you. And purely coincidental that two marathon runners ended up with an annual fund was a marathon number. But anyway,
yes.
No, it's really been great. I think what I've admired a lot about working with you and the affiliate, but like you have an ability to really sort of see the longer picture and sort of understand the time it's going to take to get there, but then also sort of react in the real time. And sometimes, the staff needs help sort of seeing that longer vision, but like I think you all do a great job of it. Obviously, your organization is going through the things that it's going through, but on some level, leaders across organizations, particularly healthcare organizations, progressive organizations, what would be your advice to leaders and organizations right now as they kind of meet this moment and sort of look to the future as well?
Well, I think the biggest thing is to think about where you are now and know that you can't stay there, that in order to be here in the future, you have to continue to grow, be curious, and really push your team and grow with innovation. That's the only way we're going to be successful into the future. We have to be looking at, especially as a nonprofit, as a healthcare nonprofit, we have to continue to understand how healthcare is changing. And it is literally an art and science and continues to grow and change every day. But you have to have staff that have the skill set and the training to be able to adapt to that. So really supporting your staff and team, to have a board that's open and willing to really reach and ask and introduce you to folks so that we can grow our development. Because without that as a nonprofit, as an example, we're sliding people to zero that are coming in from these 41 states. That has increased our the line that allows us to get reimbursed for that. And so without that, board support, staff support, we're not going to be able to continue to be here in the future. And to really focus on taking care of yourself and your team, which is really important. Self-care is important. And my bachelor's is in health education, so I'm always talking about that. But also making sure your team's taking care of themselves, because we can't be here in the future without that. So it's really, really important. And also just taking a breath and celebrating some of the successes you have. As a nonprofit leader, you're always looking at the next problem, the next issue, the next concern. And if you don't take the time to take a step back, you're losing some team members along the way. And that's important also.
Absolutely. And I love that idea of, if you're not sort of growing or thinking you're like, you're not going to be able to stay the same. So like, just get that out of your head and sort of lean into change is an amazing point. Well, Stacy, I really appreciate you taking some time to chat with our audience today. And more importantly, I just appreciate you. So thank you so much.
Thank you.